Hello and welcome. So, are you ready to get your head around one of the biggest, meatiest topics in your GCSE history exam? Yeah, we're talking about 1,000 years of medicine in Britain. It's this massive story of progress, of standing still for a long time and then revolution. Revising all of that can feel pretty overwhelming, but honestly, don't worry. This is your roadmap. We are going to break this whole thing down and show you exactly how to conquer it.
So the big question is, where do you even start with a whole millennium of history? It seems kind of impossible, right? Well, here's the secret. It's not actually about memorizing an endless list of names and dates. The real key, the actual blueprint for doing well in your exam, comes straight from the examiners themselves. It's all there in the official AQA specification. And the best part is, it doesn't just tell you what you need to know, it tells you how you need to think about it.
So here's how we're going to tackle this. First up, we'll decode that exam blueprint. Then, we're going to take a journey through the 4 key time periods: the medieval era, the Renaissance, the Industrial Revolution, and then the modern age. And to finish, we'll arm you with the 7 key factors that AQA really wants you to use in your analysis. Right, let's jump in.
All right, first things first. If you want to get those top marks, you absolutely have to start thinking like an examiner. It's not enough to just list facts about Jenner or Fleming. You have to use that knowledge to answer the big, overarching questions that this entire course is actually built around.
These 5 questions right here, they are everything. Seriously, you need to burn them into your brain. Every time you revise, you should be asking these questions. Why did medicine suddenly take off in the 19th century? Why was a guy like Galen so significant for so long? Answering these questions is what changes your revision from just passively learning stuff to actively analyzing it. And believe me, that is the key to a top-grade essay.
Okay, let's start our journey. Part 1 takes us way back to the medieval period. And this was an era where medicine was pretty much dominated by ancient ideas, by tradition, and by religion. For centuries, progress was, to put it mildly, incredibly slow. For hundreds of years, the medical world was basically frozen in time. The ideas of this ancient Roman doctor, Galen, they were treated as absolute gospel. A big reason for this was that his work fit really neatly with the teachings of the church, which, controlled pretty much all learning. Church-run hospitals offered comfort and care, kind of like a modern hospice, but they couldn't offer cures. And then, 1348, the Black Death arrives. A catastrophe that killed nearly half the population and just completely shattered everyone's confidence in everything they thought they knew. So what did people actually believe caused disease? Well, ideas were kind of split. On one hand, you had supernatural beliefs. So illness was a punishment from God, or maybe it was caused by the alignment of the planets. But on the other hand, you had this rational approach that came from ancient Greece, the theory of the 4 humors. The idea was that your body was like a container of 4 liquids: blood, phlegm, black bile, and yellow bile. If you were healthy, they were all perfectly balanced. If you were sick, one of them was out of whack. This one idea dominated medicine for over 1,500 years, and it was a massive barrier to finding the real causes of disease.
Now we move into the Renaissance, which literally means rebirth. Look, this wasn't some overnight revolution, but it was a really crucial period where the first cracks started to appear in those old medieval ideas. For the first time in centuries, people actually started to question authority and, look for the answers themselves.
And this new spirit of inquiry was led by some absolutely brilliant individuals. You had Andreas Vesalius, who started dissecting human bodies and proved that Galen, who had only ever worked on animals, was wrong on over 300 points. Then there was the battlefield surgeon, Ambroise Paré, who came up with new, gentler ways to treat wounds. William Harvey proved the heart was a pump that circulated blood, which completely overturned ancient theories. And finally, Edward Jenner used careful scientific observation to develop the world's very first vaccine, a monumental step in preventing disease. This slide really gets to the heart of the fundamental shift, the crucial change in attitude. In the medieval period, you proved you were a good doctor by quoting Galen from a book. But in the Renaissance, pioneers like Vesalius and Harvey, they proved they were good doctors by observing the human body for themselves and proving Galen was wrong. That scientific mindset, that was the real breakthrough of this whole era. So this new way of thinking eventually built into a full-blown revolution. If the Renaissance lit the spark, you could say the Industrial Era fanned it into a roaring flame. This period saw some of the most rapid and important medical discoveries in all of history, and it was driven by scientific progress and the massive new health problems created by these huge industrial cities. The pace of change was just astonishing. First, you have James Simpson discovering anesthetics like chloroform, which lets surgeons perform longer, more complex operations. But this actually led to more deaths from infection. And that problem was solved when Louis Pasteur published his germ theory, which Joseph Lister then used to create antiseptic surgery. At the exact same time, these deadly cholera epidemics were forcing the government to finally take responsibility for public health, which led to the landmark Public Health Acts. It was all connected.
Let's just pause on this for a second, because germ theory is arguably the single most important development in this entire course. Before Pasteur, the big idea was miasma, the belief that disease was caused by bad air or just sort of appeared out of nowhere from decay. Pasteur proved that specific, tiny, living organisms, germs, caused specific diseases. This was a complete game changer. I mean, if you know what causes a disease, you can finally develop vaccines to prevent it, and you can create targeted treatments or magic bullets to cure it. And that brings us into the modern era. In the 20th and 21st centuries, the foundations that were laid in the Industrial Revolution were built upon at an incredible speed. Factors like brand new technology, government action, and even global warfare would dramatically accelerate medical progress. If there is one date you remember for this period, make it 1948. This was the year the National Health Service, the NHS, was born. After the shared struggle of World War II, the government adopted the recommendations of the famous Beveridge Report, which was all about slaying these 5 giants holding Britain back, things like poverty, disease, and bad housing. The creation of the NHS was a truly revolutionary moment. It established for the very first time that good healthcare was a right for every single citizen, completely free at the point of use. Technology and war became these huge drivers of change. Penicillin, for example, was discovered by chance, but it took the industrial might of the US government during World War II to make enough of it to save countless lives. The horrific injuries from trench warfare in World War I forced doctors to innovate at an incredible pace in things like blood transfusions, x-rays, and even the new field of plastic surgery. And that technological momentum has just continued, leading to modern marvels like transplant surgery and keyhole surgery. So we've covered the what and the when. But to get the top marks in your exam, you absolutely have to explain the why. And this next part, this is your secret weapon. The AQA specification gives you an analytical toolkit, 7 key factors to explain why change happened, or, just as importantly, why it didn't. And here they are. You can use these to explain pretty much any development in the entire course. Why did medicine stagnate in the medieval era? A big reason was religion. Why was germ theory so revolutionary? Well, that's down to the role of an individual, Pasteur. How did surgery advance so quickly in the 20th century? War. Why did cities finally get cleaner? Government. It's a framework for, well, everything.
And here's how you actually use this in practice. A really top-level answer will always explain how these factors link together. Take Jenner's vaccine. Of course, it needed him as a key individual using science, but it only really took off thanks to communication and, later on, government support. Or think about penicillin. It starts with Fleming's chance discovery, but it goes absolutely nowhere without the key individuals, Florey and Chain, the power of science, and the backing of the US government during a time of war.
So, let's test it out. How would you explain the creation of the NHS using this toolkit? You'd probably start with government, of course, but you'd also want to bring in the huge impact of war. World War II really changed attitudes. You'd definitely talk about the role of the individual, William Beveridge. And you'd mention new scientific ideas about public health. See? Linking factors like this is how you build a powerful, really analytical argument. So here's the crucial point. Your revision now has a structure. You've got the 4 key time periods to organize your knowledge, and you have the 7 factors to explain the change and the continuity within them. This framework gives you the power to tackle any question the exam can throw at you, because you don't just know what happened, you understand the forces that shaped history. And to leave you with a final thought, which of these factors do you think will drive the next great medical breakthrough? Will it be science and technology, like AI diagnostics? Maybe it will be government investment in tackling antibiotic resistance. Or could it come from the role of an individual that we haven't even heard of yet? By understanding the past, you really do have the tools to analyze the future. Good luck with your revision.